Good morning, Jackson College practical nursing students. Today we will be assessing our client with a head-to-toe clinical assessment. And in that I'm also going to include listening to their pulse and their respirations. You just finished watching your vital signs video and I did not emphasize those there, so I will emphasize those two assessment pieces with this head-to-toe. Okay? So we're going to start right from the top as if you were going to enter the room. We're going to start with our GNAP, and then when we're all done, we're going to exit with our exit procedures. So please continue to practice that. Knock, knock, knock.
Come in.
Good morning, Mrs. Smith.
Good morning.
My name is Darlene LaPresto, and I'm a nursing instructor at Jackson College. And I'm here today to perform a head-to-toe assessment on you.
Okay, sounds good.
Okay. And hygiene. This assessment's going to take about 15 or 20 minutes.
Mhm.
Do you need to go to the bathroom before we
Nope,
start?
I'm good.
Okay. Are you having any pain?
I had some mild pain, but I took some Tylenol the nurse gave me, so
Okay.
it's better.
It's better. So on a scale, pain scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain right now?
Probably a 2.
A 2. Okay, I will make note of that. At any time during the assessment, if you feel like we need to stop, please let me know. We can do that, and then we'll start back up again.
Okay.
Okay? All right, so we have the pain assessment done. Now we're going to start from the beginning, and we're going to assess level of consciousness and orientation. So Mrs. Smith, can you tell me what day it is today?
Tuesday, March 17th
Okay,
of 2020.
very good. And do you know where you are?
Yes, I'm at the Jackson College lab.
Okay. And can you please tell me your name and date of birth?
It is Mrs. Smith, and my birthday is 5/8/75.
Very good. Okay, thank you. And I'm just kind of checking now just to see if she's maintaining eye contact with me, if she has a flat affect, or if she's smiling at me. What is her overall cognition? I'm just assessing without letting her know I'm assessing what her overall appearance is. She appears well nourished, she's young, she appears hydrated, those kinds of things that you don't really have to ask, that you can just assess with your eyes, ears. Okay? So she looks well nourished and healthy for her age. We're going to start with the head now. So Mrs. Smith, I'm going to touch you.
Mhm.
Okay? So hair distribution, normal for her age. I don't see any spots where there's any alopecia at all. So I'm just going to palpate and inspect just to see if there's any lesions, bumps, lumps, bruising, anything like that. And I don't see any. Normal eyebrow distribution, eyelashes as well. You want to be sure you check that. Sometimes people have chemotherapy and they don't have normal hair distribution. Okay? We're going to move to the ears. And again, we're going to palpate and inspect. I don't notice any nodules, no drainage. Any pain in either of your ears?
No.
No? Okay, very good. All right. Now, your nose. Any trouble with your nose breathing? Have you had any injuries?
No, I have allergies, so stuffy from time to time, but nothing to
Okay.
be concerned about.
Okay. So I'd like you to place your finger on one nostril and close it, and then take a deep breath. Good. Okay, and then repeat on the other side. Good. Okay, very good. Thank you. All right. Next, we're going to look at assess the oral cavity. Okay. And so, Mrs. Smith, if you can just open wide. Okay, and stick your tongue out. Good. All right. And what we're looking for here is, again, any paleness, any cyanosis inside the mouth, on the mucous membranes, the tongue, any dryness of the tongue, lesions, lumps, bumps, anything that might be abnormal. Dentation. Does she have her own teeth, or does she have dentures? Are you experiencing any nausea or vomiting? No. And how's your appetite been?
Good.
Good? Okay.
Mhm.
All right. So again, we're assessing nutritional status. I'm going to go back and check her eyes because I'm still assessing the head. So Mrs. Smith, I have a pen light, and I'm going to shine this in your eyes. So I'd like you to pick a point on the ceiling and just take a look there. And I'm going to shine this just briefly in your eyes. Okay? Okay. And what we're looking for here is making sure that the pupils are round, reactive to light, and that they accommodate. So what that means is when I shine the light in one eye, then her other eye also constricts at the same time. So I would describe her pupils as 1 millimeter round, and reactive to light and accommodation. Okay. Now we're going to move down to the neck. And again, you're just going to palpate, looking for lumps, bumps, bruises. And if you'll just turn your head. We're going to check her carotid pulses. Very lightly, you don't want to occlude them. Okay, and this way. They're just into the groove to the side of her trachea. Okay, thank you. And they are strong and equal bilaterally. Next, we're going to move down to the upper arms. And what you want to do is do a really good skin inspection. So, lift the patient's arm up, look behind, look in those armpits, all the way down on both sides. And again, you're looking for any abnormalities, skin tears, lumps, bumps, bruises, IV sites, anything that might be abnormal or something that we would have to keep an eye on. Her skin looks clear, no lesions, skin's intact. Next, I would check skin turgor. So we are checking hydration. So we pinch the skin lightly and let go. If it stays tented, that means she's a little dehydrated, but if it has good elasticity, it will go right back to its original position. So again, we do it on both sides. Everything that you do, you want to do bilaterally. Okay? Now let's finish checking our pulses. So we have a brachial on each side. So firm pressure with the brachials because they're deep. Good. Nice. And then radial. 2 fingers, not your thumb. Okay. Good. And then after this, look for edema, or at some point when you're working with the arms, you can do these in any order as long as you try to remember to hit all of these. So we've done the skin integrity, we've done skin turgor. Now we're looking for edema, so any swelling anywhere in the upper extremities. That would mean fluid volume overload, and we want to report that to the physician. I don't see any edema at all. Lastly, we're going to check strength. Mrs. Smith, if you will squeeze my fingers as best as you can. Good. Now we're testing that bilaterally because again we're testing a cranial nerve. So you take 2 fingers, not just one, 2 fingers away from your ring and have the patient squeeze as hard as they can. Very good. Lastly, on the upper extremities, we're going to do a capillary refill. And capillary refill, you simply just pinch one of the fingers and let go. The fingernail should blanch, and then the pink should come back within 3 seconds. And we're going to do that on both sides. We're always comparing one side to the other. This is checking circulatory status. So people who have a compromised circulatory status, they may have a capillary refill greater than 3 seconds. All right, that completes the upper arms. And so now we're going to move to the chest area. First thing, before I move to the chest, I do want to finish with jugular vein distension. So we need to talk a little bit about jugular vein distension. I'm going to put Mrs. Smith down in a 45-degree angle. And I'm going to move your pillow up just a little bit, okay? Here you go. Okay. Jugular vein distension occurs when patients have fluid volume overload. So for example, like congestive heart failure. So what we do is we have her ask her to turn your neck to the side. And really I probably should have done this when I was working with the head and neck, but as long as you remember, if you forget something and then you remember like I just did, and you come back and do it, then you're okay. We just don't want you to totally forget it throughout the assessment. So when I was doing her carotid pulses, that would have been a perfect time to check her neck vein distension. So you locate the angle of Louis, and you come straight across. So the bottom about 2 to 4 centimeters is where we're looking on the jugular vein to see if there's any distension. We don't palpate, we just observe, and she has none. So then Mrs. Smith, if you'll turn this way. And again, she's at a 45-degree angle, and we're looking right about here, and she has none. Okay, thank you. All right, I think I'm ready to move to the chest now. The first thing that I'm going to do is listen to her heart sounds. And with this, you need to memorize where their heart valves are. So you need to start palpating either yourself or your honey bunny at home, and you need to learn to locate. So we're going to learn to to count intercostal spaces. So the first place we're going to listen to the heart is the second intercostal space. So you roll over those ribs, 1, 2. And with your real clients, get right under that gown and be skin to finger contact, or with your equipment, with your stethoscope. You want that right on their skin, not through the gown, because that might alter your assessment findings. But for this video, we're going to maintain modesty and we will do it through the gown. So I'm going to take a listen. Second intercostal space, right at the sternal border. And we're listening to rate, rhythm, and volume. Those are the 3 characteristics of pulses. Okay, then I'm going to come over to the pulmonic valve, second intercostal space, directly across. Okay, spend about 30 seconds to 60 seconds. Then we go down to the 5th intercostal space, directly on the breastbone, just at the side of the breastbone. This is going to be tricuspid. Okay, and you have to press kind of firmly. Okay, and lastly, we're going again, 5th intercostal space, but at the mid-clavicular line. So your clavicles right here, right in the middle. You're going to go straight down over the nipple, and then I'm going to lift your breast. Lift your female's breast with the back of your hand so that you can find the apex, because the 5th intercostal space is right below the breast line, and right here is your aortic, pulmonic, tricuspid, mitral valve. That is the apex of the heart. That's where the heart sits closest to the chest wall. And so we want to be able to get the best auscultation of the heart sounds in this spot. Now this is where you're going to spend a full 60 seconds, again listening to rate, rhythm, and volume. Don't spend less than 60 seconds, because if you have a patient who has an irregular heart rate, maybe due to a dysrhythmia, you may miss that, or you may not be able to hear the heart murmur because you didn't spend enough time listening. So be sure that you spend 60 seconds there, especially in the beginning of your nursing career. A lot of people will listen to heart sounds for 15 seconds and multiply them by 4, and that's fine when you get to be a little more seasoned, but at this point we want you to be able to listen long enough so that you can determine if there's an irregularity or not. And even seasoned nurses will do that as well. Okay, so we've done all of our pulses. Another thing with the apical pulse, if you have someone that's very distant, you can have them lean forward, or you can have them roll to the left side. That brings the heart closer to the chest wall, and then hopefully it will enhance auscultation when you're listening to the heart sounds. All right, now we're going to move on to lung sounds. And with lung sounds, we always start at the top, work our way down, and we compare one side to the other. We are always comparing one side to the other, down, one side to the other, down. And in your textbooks, I want you to make sure that you look at those pictures, because it's very graphic on how high you start. You want to start above the scapula, or above the scapula on the back, and above the clavicles on the front, because that's where the apex of your lungs are. And then they go all the way down past the 6th or 7th rib, okay? So, I'm going to listen to your lungs now, okay? You have to go potty yet?
Nope, I'm good.
All right, how about pain?
Nope.
No? Okay. All right, so we're starting above the clavicle, so palpate the clavicle and place your stethoscope and just listen. Now the client, you're going to breathe nice and easy for me, just regular, in through your mouth and out through your nose. And now I'm just going to compare. I'm going to just have her breathe nice and easy. Don't want her to hyperventilate, and I'm just going to work my way down the chest. And just notice anywhere that you listen on one side, you're going to listen again on the other side. I'm gonna lift your breast again. Okay, and then right middle lobe, we want to go under the axilla. Good. I'm forgetting something. Respirations. Oh yeah. At this time, I would also, as I'm listening to her lung sounds, I wouldn't tell her, but I would just count her respiratory status, count her respiration. So between 12 and 24 breaths per minute is normal. And I don't want her to know that I'm doing that because she may start breathing quicker or she may hold her breath, so she might alter her normal respiratory status. So while I'm on the chest, I would still listen to her respiratory rate, just kind of pretending that I'm listening to her heart. So when you do your head to toe, that's kind of a nice trick to do. Listen to her heart sounds, and then just continue to leave your stethoscope there, and then pay more attention to the respiratory rate. And then you'll have both of those assessments done. Now, what we would do next is we would listen to her lung sounds in the back. I'm not going to have her set up, but we would do the exact same thing. We're going to start at the very top, above the scapula, and then work your way across and down, across and down, across and down, all the way down to the bases, which are going to be just about where above the kidneys. So again, take your time and go slow, and take a look at your textbook to make sure that you're hitting all of those spots. All right? So we're done with the chest. Now we're going to move on to the abdomen. My coach says, yes, abdomen. All right, so now with the belly. We do not palpate first with the belly. We auscultate first. If you palpate first, you will stimulate peristalsis and you will alter what their normal bowel sound pattern is. So the first thing we're going to do is listen to her belly. Now again, you want to get underneath the gown, underneath their clothes, and be skin to stethoscope contact. But for the sake of this video, we're just going to do it on top of the gown. When you start, you always listen in the right lower quadrant first, always, because anatomically, and you've heard this on the other video that I have played for you for class, anatomically your large colon starts in the right lower quadrant. It goes up ascending to the right upper, across is transverse to left upper quadrant, and then descending goes down to left lower. And so always, always, always start in the lower. You're going to hear 5 to 30 clicks per minute usually for regular bowel sounds. And again, this is where you need to spend some time. If you have a patient who has altered bowel sounds, or maybe they're in for dehydration, or maybe they're constipated, or they're worried about a bowel obstruction, you may hear bowel sounds in one side but not the other. So you really need to listen and compare. You don't have to press very hard. But spend some time to make sure that you're listening. Okay. So after I've listened, now I can palpate. Now as LPNs, we just do light palpation. We're not palpating for the liver border or anything like that. That's what the RNs do. Any tenderness when I press on your tummy? And just go across the abdomen and down, and just ask the patient if they're having any discomfort at all. Do you have any problems with constipation?
No.
No? Are your bowel movements every day, every other day?
Every day.
Every day? Okay. All right. Do you take any medications to help you move
No.
your bowels? No? Okay. How about bladder? Are you able to hold your urine?
Mm-hmm.
Okay. And about how many times a day do you think you go to the bathroom?
8 maybe?
Okay.